There's a whole long list of different menopause symptoms, and really we know about the common ones. So, but I would broadly break them down into two categories, and I think this is a useful way of looking at them. You have the physical symptoms, and then you have the emotional, psychological symptoms. So some of the physical symptoms would be your hot flushes are probably the most common. Then anxiety, although that would probably be best placed in the emotional category. Vaginal dryness, urinary incontinence. These are some of the physical symptoms that are common. Lack of disturbed sleep, although you could maybe place that partly in the emotional category as well. And most people tend to focus on the physical symptoms when they talk about how intrusive menopause symptoms can be. However, about 50% of women will have some kind of emotional disturbance as well. It's very underestimated, but nevertheless very intrusive. So some of those emotional symptoms will be anxiety, depression, more stress, lack of mental clarity, a lot more variability in emotion and emotional instability, very, very commonly reported. And often what these women need to restore their well-being is not an antidepressant, but they need to be given their hormones back, preferably in a natural form. Hormones tend to decline in a woman usually between the age of 45 and 55. And that's when most women, and when I say most, we're probably talking about 80% of women, will have some kind of symptom, either physical or emotional disturbance. And in my book, and in what we do and what I do in my clinic, once I've assessed levels and established that they are diminished, I restore the hormones in a natural way. And what will happen as a natural consequence of that is that often both emotional and physical symptoms will very quickly resolve over a period of 2 or 3 months. Menopause can be extremely intrusive in women, and in some more than others, and we underestimate its impact, in my opinion, and probably men underestimate the impact on women. Although they secondarily may suffer from the effects of that in their partners, for example. So, what we find time and time again in the work that I do here with restoring hormone levels, with natural hormones, is it's a way of restoring a person's emotional and functional balance. And we can normally achieve that very quickly, very pleasing results. The nice thing about using natural hormones is that they tend to not have some of the downsides and side effects that the synthetic hormones have.